During the COVID-19 pandemic, dentists are only seeing patients in cases of emergencies, but for other more urgent care, some dentists are now finding ways to keep their patients safe. News Channel 9's Julia LeBlanc spoke with one family who found a solution, and she's joining us live this morning from St. Joseph's Hospital. So good morning to you, Julia. Tell us about this family story.
Good morning, Jennifer. Well, the couple we spoke with had their baby Elijah here 5 months ago, and Elijah was born with a birth defect, and so he has to see a dentist weekly. Now, those doctors are only available in Rochester, so each week him and his family travel to and from Rochester, 4 hours there and back to get that treatment, and they're getting it right now out of their car because of COVID-19. This has become the norm for Anna, David, and baby Elijah. Each week, they make the 2-hour drive to Rochester, park curbside, and their doctor meets them out front.
Never in my life did I think I would be taking my baby to a dentist appointment to begin with, let alone weekly drive-through dental appointments.
5-month-old Elijah was born with a bilateral cleft lip and palate. At 2 weeks old, he was given this appliance called NAM, a nasal alveolar molding device, and needs to be worn within the first few months of his life to prepare for corrective surgery, an exception for dental treatment during COVID-19, where dentists are only handling urgent or emergency cases.
It's really looking good.
Too. Yeah. Dr. Erin Shopey wanted to limit the family's exposure. She meets them outside in full protective equipment, adjusts the device inside, and then sees them off.
I didn't feel super comfortable having the family and the baby come into the hospital or into our dental center if we didn't need to have to do that.
I think it was more for ourselves, actually, our ability to care for him if we were to become sick.
COVID-19 could have halted this treatment during a critical time in Elijah's life. Dr. Shopey says the implications could have impacted not only his appearance, but his speech, his ability to eat, breathe, and even hear. Consequences Anna and David were sure they'd have to face because of the pandemic, which is why they're grateful a 4-hour drive is the only thing standing between Elijah and a better life.
It really made me empathize with parents living in other countries where maybe because of the way the healthcare system is or their economic situation, they might not be able to get treatment for their children at the time frame when it's most critical.
Now, Dr. Shopey says dental offices are choosing to remain open right now to handle those emergency cases so people don't end up here at hospitals like St. Joe's. She says they're not performing many surgeries right now to preserve things like ventilators and anesthesia. Live at St. Joseph's Hospital, Julia LeBlanc, News Channel 9.